Hello, good evening. This is Simon Downs. I'm broadcasting from Tokyo, Japan, and this is the Med Student Lounge. And tonight we will be talking with Dr. Ven Mulpuri, who is an internal medicine doctor from Michigan. And I met Dr. Mulpuri in Hangouts with Dr. Bennett, most recently in neurosurgery Hangouts. And I became interested in learning a little bit more about Dr. Mulpuri. And he was kind enough to agree to share his journey and explain about what he's doing at this moment. Dr. Mulpuri, welcome.
Thank you, Simon. Thanks for inviting me to your hangout. Um, uh, uh, like you already know a little bit about me. I came from India as a medical graduate to USA. Um, but to go back to India a little bit more, getting into medicine is kind of it's very competitive in India,
Yes.
and compared to the students that we have who compete for these seats, medical seats, the medical colleges those days were very less compared to now, because now there are so many medical colleges. But anyway, I wanted to try. I mean, after completing my 12th standard, then immediately I didn't get into, because I was not sure what to do at that point. So then I got into BSc, Bachelor of Sciences. I did it for 1 year, and during that time I realized I should get into medicine, and I started preparing for medicine. And
Sorry, were
in
you
that,
considering other specialties, or were you considering other subjects, or were you always interested in medicine?
I mean, I was always interested in medicine for some reason. Maybe because I watched my maternal uncles dying of strokes. Maybe that kind of made me interested in medicine. But anyway, so while doing my BSc, I simultaneously prepared for medical entrance exam. That's called MSET. That's a common
Hmm.
medical examination for medicine and engineering.
I see.
But for people I mean, students who try for medicine, they have more of biology-based questions.
Hmm.
So, but as I was trying, I heard about this Mahatma Gandhi Institute of Medical Sciences, Medical College. Actually, that was suggested by my other uncle, and he mentioned that it's a very good college, but it's very competitive. So, well, so as I was preparing, I thought, just give it a shot.
Hmm.
I tried for this, because the exam is not, conducted everywhere. I had to go to that state, and so I went there and I took the test, and fortunately, I got into the, medical college. Um, so that's when my medical career started.
I see.
Yep. And MGIMS, that's Mahatma Gandhi Institute of Medical Sciences. It's a wonderful college. Mahatma Gandhi himself, he started this college
Really?
because that area was full of, many endemic diseases, and I mean, there's a lot of infection, and a lot of health problems were there in that area. That's called actually, that the central part of the India. So he himself, he created a ashram. I don't know if you're familiar with ashram. Ashram means that people sit there and meditate, and actually during the British movement, he wanted to make his own clothes. So they used to have these manual milling things, and he made, that's where he spent his time while teaching others, you know, about
Yes.
non-violence and all these things. So that's called Sevagram Ashram. That's kind of close to the medical
Hmm.
college. So it's very interesting that first few months we have to go to we have to spend in that ashram
Wow,
doing
fantastic.
our own chores, like
Really?
yep, cleaning the toilets,
Mm-hmm.
cooking our own food, cleaning the
Ah, it
dormitories
reminds
and
me of the
everything.
movie Gandhi, that movie, that fantastic movie
Yeah,
of Gandhi.
I mean that ashram was there in that movie
I
actually.
see. I
Actually,
remember
we
that.
were studying at that time
Mm-hmm.
when that
Really?
movie came on. Yep,
Wow.
yep. Um, but anyway, so we followed Mahatma Gandhi's principles those days, like doing our own things,
Mm-hmm.
doing. We used to do meditation also. There used to be
Really
people who
fantastic
come and
experience.
teach us like the meditation early in the morning.
Mm-hmm.
It was really very well,
Mm-hmm.
orderly created program.
A wonderful
Very.
experience.
It's a wonderful experience. Every day, apart from the medical curriculum, we used to have these community services. Sometimes, we have to clean the streets. We have to plant plants, kind of,
Mm-hmm.
and also during our medical training, we were assigned some villages. Every batch it's assigned to some village. These are underprivileged the villages with more health problems. They're
So,
very
excuse me, sorry to interrupt. So you're saying at this time you're 18 or 19 years old, you are starting to study your medical sciences and you're assigned a
Mhm.
village that
Right.
you go to and you learn about the community
Yeah,
challenges, health problems.
right, absolutely. It's not just about, me going alone. It's like, our whole group. Like our, 64 students, we used to go by a bus. And, I think it's every month, once in a month.
Hmm.
The village name, it's called actually a Rome project, rural Rome medical education, something like.
Hmm.
I forgot. I just
Yeah, a long time
I'm
ago.
blanking out. Yep, it's been a long time.
Hmm.
But anyway, we used to go there, every month, and we were assigned like, some families, like, me, I was assigned to a family, that has actually two, three families, I think, not just one, two, three families,
Hmm.
the neighbors. So I used to, this was in first year. I
Hmm.
didn't even know anything.
And
But
at this time you were not
we,
thinking at all about going to live in the United States.
no, not at all, not at all. Yeah. So we used to take care of these patients. At the beginning, we didn't know what we were looking for, and also we didn't have much experience because we are just first year students. But as we progressed to the final year, as we gain more knowledge, you know, then we used to help these patients, and we used to take care of them really good. And that's how this program was really created.
Hmm.
It's very, very organized, and and very, um, you know, um, educating, and also it also teaches us the patient's tolerance,
Mm.
the characters that the doctor needs to have, the ethics and the things that a doctor should possess himself to become a doctor.
I may ask a question regarding language. Did you take classes in English or were you taking the classes in the local language? When were you exposed to medical English?
Absolutely, that's a very interesting question. I'm glad you asked me that. Actually, until 10th standard, I was studying in my mother tongue.
Hmm.
That's Telugu, because in India, every state has its own language. And so my mother tongue is Telugu. And actually, in India, we have three languages. Like, every state has its own mother tongue. And then there's a national language, Hindi. And then there's the official language. That's where the official things, are carried out, like,
I see.
administration and those things. They happen in English. But but the national, people who, like, who needs to go to capital city or some other cities, they need to know, I mean, Hindi, because that's majority of the people know Hindi. Most of the northern part of India, they know Hindi,
Mm-hmm.
but southern states, they're so, stick to their mother tongues.
Mm-hmm.
They don't want to lose their mother tongue. That's why they don't want to learn Hindi at that
Mm-hmm.
time.
And what was it that
So,
brought you to the United States? At what part of your career did you make that decision?
uh, actually, everything changed when I, met my future wife at that time. But eventually, she was my wife. Um, she has a green card because her sisters and her parents, they were all in USA at that time.
Mm-hmm.
So she didn't have any choice other than coming to USA. She's a brilliant. She did her medicine from the same state. That's
Mm-hmm.
been to medical college. Most of the doctors in US are practicing her from the same medical college
Really?
where she came from, because
Wow.
they're very smart people.
Mm-hmm.
And she also did DGO. I mean OBGYN and post graduation.
So specialty was OBGYN.
Oh my God, getting into specialty is such a competitive thing.
Mm-hmm.
They barely two or three seats post graduation, and thousands compete for it. And she's so smart, she picked one. She got,
I see.
you
Great.
know, yep. But about me, after completing my MBBS, I was not sure what to do. But in the meantime, I met my wife, and we have we thought and we have planned. There's no other way. I mean, there's no other option than coming to USA to have a
Mm-hmm.
better life. So I just thought in the meantime, while I in this process, I asked my wife applied for me to the green card. It would take 5 years. I thought how to spend these 5 years, and in the meantime I joined at Nizam's Institute of Medical Sciences. That's
Is that in
actually
Michigan?
no, that's in India, Hyderabad,
Oh, I
because
see.
I didn't come here yet.
Oh, okay.
Yep, I joined as a junior doctor there. I mean, this is like a DNB residency program. You rotate in different different specialties. But I was very much interested in plastic surgery, so I spent more time in plastic surgery. I learned a lot of things. I mean, like I used to suture fingers. The cut.
Really?
I mean, that this. The ones. I mean, not replantation,
Mm-hmm.
not the microsurgery, but suppose the tips were cut off.
Mm-hmm.
If they were crushed, because if they were crushed, you can't replant. I mean, them. If they're cut like straight, then you could replant them.
Mm-hmm.
So our professor they used to let us do the crushed ones, because
And you were
there's
thinking
no.
about becoming a plastic surgeon?
Yeah, at that point. But again, I realized, after coming to USA, it's not that easy to get into plastic surgery.
Mm-hmm.
It's not, especially for foreign medical graduates.
I see.
I mean, the chances are really, really, it's very less.
Mm-hmm.
The But anyway, so I really enjoyed my plastic surgery rotation. I used to suture a lot of things. I mean, I even sutured the tongue, which almost,
Really? Wow.
I mean, patient came with like the hanging tongue, like, it was just
Wow.
barely hanging there. And it really healed well. I mean, after the suturing.
Wonderful
And we
experience.
used to do skin grafting.
Mm-hmm.
We used to do skin grafting, like for burns and things,
For
the
burns,
patient
yeah.
lost his,
Mm-hmm.
what is that knife? I forgot the name. I think Humphrey's knife or something. That we peel the skin, and then we clean the other area, the
Wow, so many
recipient area.
years of experience. Mm-hmm.
Yep. So that's really interesting. I mean, it was exciting for me.
Mm-hmm.
So after finishing this, uh, because it's my wife already gone there to USA at that time, and she applied for me. But I realized, continuing there, it would take a long time, and also I thought I should come to USA, somehow. Then I realized there's a research program that is going on at the same hospital where my wife came for residency. Then I applied, and luckily I was sponsored H-1B visa. So then I joined this research department as assistant, research assistant.
Mm-hmm.
And I mean, it was a team of like a PhD and also nurses. And this is actually a inter-institutional collaborative heart study, which has been conducted at different medical colleges in Michigan. So, I happen to involve at the Michigan. I mean, the Saginaw. Those days it used to be called like Saginaw General Hospital.
Mm-hmm. So at
So
that
that's
time
where
you
I.
were considering cardiology specialty?
Not really, not really, not at that point. Not at that point.
But a great way to come into the States and to start working and then to think about which area you want to concentrate on.
Hmm. Yeah, that was just an opportunity for me to come to USA, and also it's a very good experience to, to understand the culture and I mean, to get into the system.
Mm-hmm.
It's like prepared me to get into residency.
Yes,
That
the 4-year residency, right?
mhm, and, to be able to understand English, to pick up,
Mm-hmm.
the American
Right.
accent and the culture and the norms and things.
Yes.
It made it clear for me just, prior to getting into residency.
Mm-hmm.
And also, that research, I mean, that was really helpful. I learned how to, perform a research and things,
Mm-hmm.
how to conduct a project.
Right. Takes a long
Uh,
time. I
yep,
published a few studies myself. It
yep.
takes a long
So,
time. So the
so
next
when
step
I
was.
joined, yeah, when I joined as a research assistant, I was involved with the, like I mentioned, the MIT study, Michigan State
Mm-hmm.
Interinstitutional Collaborative Heart Study. For this study, I have helped our group to identify the patients. Like, the basic idea was, the purpose of this study was to identify the patients who had myocardial infarction, who have had myocardial infarctions, and we wanted to see if the treatment was done properly or not.
Mm-hmm.
Like, the ACE inhibitors, if the patient is
Yes.
hypertensive, the ACE
Yes.
inhibitor was given. If the patient has hypercholesterolemia, if he was given a Lipitor or those kind of lipid lowering drugs,
Mm-hmm.
or if the patient has type 2 diabetes, if the patient is he's treated adequately or
Mm-hmm.
efficiently, and his blood
Mm-hmm.
sugar was tightly controlled. So I mean, to look at around the various factors about myocardial infarction.
Complete follow-up.
Hmm. So basically, I help them to pick up these patients, like, from, because there are three hospitals here in Saginaw General Hospital, St. Luke Hospital, and St. Mary's Hospital. So we gathered, we identified the charts, and then I picked the patients, and then we followed these patients. What was done, if the drugs were given efficiently, the standard treatment was given properly, or if the technology was used efficiently, whether treadmill tests were done properly, or
Mm-hmm.
the other things, um, like angiograms, they were done on time, or whether they utilized, overutilized, or underutilized, those kind of things. But
And how
anyway,
long was this program?
this was 2 years,
2 years. Mm-hmm.
2 years of this MIT study.
Mm-hmm.
So then it was done. Actually, the funding was gone. So then I had to, then I focused myself, to get into residency, and then
I see.
Actually, I started preparing while I was doing research as well, for the USMLE.
The USMLE.
Yeah.
I know.
So in
Oh, neat.
'99, I'm done with all my exams.
Mm-hmm.
Then that year was a little bit late because by the time I finished my exams and stuff. So, but the next year I couldn't get into the residency. But in 2001 I got into residency in the same hospital. And then
And what residency was that?
it's internal medicine.
Internal medicine.
Internal medicine.
I see.
Yes. Hmm. So after that, while doing residency, I realized, I'm not going to continue this lifestyle
Mm-hmm.
because these calls and while I was doing residency, my wife has already done with residency, and I watch her. I used to watch her how many calls she used to get and how she had to get up in the night to
Very
address
tough.
these patients.
How long is
And
the
then
residency? Sorry, how long is that residency?
it's 3 years residency.
I
Internal
see.
medicine is 3 years.
I see.
Internal medicine is 3 years residency. I mean, like surgery is 5 years. So
Mm-hmm.
every residence is different based on, there are different programs like med, peds,
Yes.
they have pediatrics and medicine.
So you're saying that you was watching your wife, who was a little bit ahead of you, and you were seeing how she was
Yeah,
taking call and how tiring it was. That you were
yes,
just
yes.
so you knew
That
what was
kind of
coming.
discouraged me. Yep. And at the time we have two small children also, I mean, actually, I have only my son, but later we have my daughter. Um, so we realized, actually, I realized, I think if this trend continues, we can't focus on kids.
Right. Taking
We
care of
both get
children.
busy.
Mm-hmm.
So then I took the other path. Then after that, I took my MBA, executive MBA in healthcare management at Oakland University.
I see.
Actually, that's 2 years, but not. I mean, it's not a regular kind of. I don't have to go every day.
That's a lot of education. So you had the research program, the residency, and the
Yes,
MBA. You're
it's
like
not
me,
over
you
yet.
love education.
It's
It's
not
not
it's
over
not
yet.
over yet.
Yeah.
So
I
after
also love
finishing
learning.
MBA,
Uh-huh.
after finishing MBA,
Mm-hmm.
then I because at the time this EMR is getting popular.
EMR. What is
Electronic
EMR stands for? Electronic
electronic medical
medical
records.
records.
Yep. Because the Obama, is kind of mandatory. I mean, is mandating all the healthcare providers to transit into the health. I mean, the medical
This is
records.
before
EMR.
Obamacare. Before Obamacare.
Yeah, it's been. I mean, it has been there even before Obama, but it's been taken seriously
Mm-hmm.
ever since Obama came into the power.
I see.
Because we have realized. I mean, there are trillions of dollars that are going wasted because of these paper charts. Because it's like it disconnected management.
Mm-hmm.
Because if the patient goes to another place, if suppose the patient is unconscious or if he happen to have accident, then the patient can't speak.
Mm-hmm.
I mean, nobody's there to answer the questions that you know to about this patient. So they had to
Mm-hmm.
do everything right from the sketch, all the investigations, everything, even though if they were done before.
Mm-hmm.
But if we have a centralized medical chart that is online available all the time, they don't have to do everything that was done before.
So it was a good idea.
Yeah, so you could save a lot of money. I mean, you don't have to waste resources which were already done on this patient. The other thing is that some of these patients, they shop for some drug seeking people. They go to different doctors saying they pretend disease. And if you have one chart, you
Then
know
you know everything.
everything. Where did he go last week, or what was done last time? What did he? When
Mm.
was the last prescription was given?
Right. But you
What
were
was
saying
he?
that there isn't just one system, though, and that's the
Yeah.
problem, right?
Hmm. But even with the EMR, it's not that nationalized right now. It's still disconnected. But at least we have a we are trying to getting what do you call that, connected through interoperability.
Interoperability.
That's in the process right now. I
Can you
hope
explain a little
someday.
bit about interoperability? What does this mean?
Interoperability means, suppose, to be able to access the patient's information at anywhere
I
you
see.
want.
So
Not just,
systems
I mean, and
communicating with
also
systems.
you should be able to extract the information. Suppose the patient goes to lab and the labs are done there. So the labs will be, you could access the labs from there in the internet. I mean, through EMR. That's what is interoperability. Or suppose if the patient goes to a different doctor, you can get directly from the, what has been done and what was he given,
Yes.
what happened at that, so all the information can be coordinated,
Mhm.
you know.
And what brought you to the interest in medical education from your journey, bringing you from interoperability to
I
now you're
mean,
thinking?
since I realized I don't like practicing medicine
Hmm.
because of the lifestyle, and also, healthcare system has changed a lot. It is not that exciting as it was before,
Hmm.
because there's lot of scrutiny, and the physicians are under a lot of pressure. And also,
Yes.
we're not getting that much as we were getting. I mean,
Hmm.
the like good old days, like, the previous doctors, they made millions of
The
dollars. But
rewards,
now,
yeah. Hmm.
yep, now there's every. I mean, we are under a lot of pressure.
Hmm.
First thing from the insurance companies, the other thing is from the EMR. The other thing,
Yes.
now we have to, you know, we have to learn how to type now.
Hmm.
Put the information into the system.
Hmm.
That's a big struggle.
Hmm.
You know, and also, if something is missed accidentally,
Hmm.
you could be scrutinized. I mean,
I see.
yeah, you should be able to document at real time into the system.
Hmm.
If you didn't do that, you missed it, and
Really?
you're liable for that if it goes
Really?
to court. Yep.
Wow.
But if, on the other hand, if it's a paper chart, you could change it anytime. I mean, you could just add an addendum, and But this
I see.
one, you can you can know when it's been done and when it was changed, or
Wow.
at
So if
what
you're doing
time.
something else, taking care of another patient, or if someone gives you a call and you can't put it in the right timing, it makes you look
Right,
bad.
right. Hmm. Even though if you did the treatment, but you didn't put it in the system, then it's not done.
But you could have a mid-level provider or someone helping you doing that, or you have to do it all yourself.
Yes, we have to. We have to. But whatever we did, I'm suppose if you take ER, you are responsible for everything. You know, at real time. If it is not documented, then you are done.
So you have to become a super fast typer. You got to be really good at computers, pull down
Hmm.
question choices and check
That
marks and
that's why a lot of these senior doctors, they didn't
mm,
prefer the EMR.
hmm. They're tired
The
of it.
younger generation, I mean, it's very easy for them
I
typically.
see. I see.
Yep.
So things are changing.
Uh, yep.
But you like education, and when I met you in the Hangouts with Dr. Bennett I think it was a neurosurgery hangout, you were interested in asking questions and also to help the medical students to understand what's the reality of medicine, but also in understanding some of the finer
Hmm.
points of learning and good
That's right.
ways to
Yep.
learn based on
Hmm.
your own experience. So now you are
Hmm.
interested in teaching as well as what your present work is as a
That's
consultant.
right.
Mm.
Yep. So, I mean, I didn't tell you, after the MBA, I did. I took a certificate course for health information technology,
Yes.
because the purpose of taking that course was to be able to help, to develop the EMR for different specialties. Because at that time, it's getting popular. EMR was getting popular, and people need these kind of physicians who could create different formats for different specialties. Like for plastic surgery or for medicine, it's a different format. For surgery, it's a different format. For radiology, it's a different format. For pediatrics, it's a different format. So actually, in the process of finishing that course, I did help a ambulatory company.
Hmm.
That's medical record company. That's called RT Medibus, Real Time Medibus. That's a Indian-based company, but actually they offer service here in USA. Actually, my wife used their software. You know what I'm saying?
I see.
My wife
Yes.
used their software, and it's been really good.
Hmm.
And I developed that. I mean, the format, not the background, the technical
Hmm.
part, but like the patient comes, the pain. What are the things that needs to be asked in
I
pain?
see.
Like the
So that's being
PQRSTs,
used now. Hmm.
the intensity, duration, the aggravating and relieving factors, and all those things. You know, uh, so this way, I mean, I set the format for different
So
specialties.
that must be satisfying that you were able to
Oh
do
yeah,
that because you're
absolutely,
making a difference.
absolutely,
Hmm.
absolutely. I also used to create the pictures,
Oh,
anatomy pictures.
so it sound like you're enjoying that.
Oh yeah,
So you're
absolutely.
utilizing your experience and
Mhm.
doing what you enjoy. And now you're also trying to take it even farther. You're going to try to reach a larger audience, and you're also trying to concentrate on individual students and
Oh yeah.
education as a
I
whole.
mean, teaching has been. I mean, I mean, I always love teaching.
Hmm.
I because somehow I don't know, but I love teaching. I
Well,
wanted,
good for us. Hmm.
yeah.
Yeah, well,
um,
I noticed that the doctors that come on Hangouts are particularly open to education and sharing, uh, whereas others are not so open. And this is a great advantage for us in this internet age where we're able to connect with
that's right.
someone like you. It's really a great opportunity,
Yep.
and
Yep.
we hope that in the future we can continue, and perhaps we will do
Hmm.
some more Hangouts, and perhaps some certain subjects.
Right. Right.
But yeah,
Yep.
so okay.
I mean, I have, it's been a long journey. Like, I have the research experience. I have the, this residency, and after that MBA and the health information technology, both ambulatory and inpatient. I didn't tell you that I also worked for a hospital where I helped, to transit them into the EMR, EHR, like
Hmm.
electronic health records. And for that, I was trained for all scripts because
Yes. Mhm.
they got all scripts. Then all scripts is a software that's actually called Eclipsys.
Hmm.
Eclipsys has been bought by all scripts, and
Yes.
that's what this hospital we worked on. And we for for this hospital, I helped them creating these auto sets.
Hmm.
Inpatient means acute care patient, basically.
Yes.
Ambulatory, they are chronic.
Hmm.
That's a totally different thing. This is acute care patients.
Hmm.
In every specialty, like in hospital, you have different kind of patients and different specialties. So I help them with different specialties.
Yes.
ER, internal medicine, surgery. First, we kind of we gather the most important order sets
Hmm.
while we initiating the transition, because they're mandatory, because they're urgent.
Hmm.
So we focus on the ER ones first, then slowly. It
So it
took a
sounds
while.
like you can make the whole system work from the beginning to the end. The intricate details, not only treating the patient, but the system behind the treatment.
Yep, I think I have seen the whole process of medical education. You know, right from the beginning to the electronic transfers and health information technology and the business part,
Right.
healthcare management.
It's great.
I have broad you know
Wonderful.
exposure
Hmm.
the
Great.
healthcare system.
Well, thank you. Well, thank you very
Okay.
much, Dr.
Yeah,
Mulpuri. And I've really enjoyed talking with you tonight, and we look forward to learning more about your experience and hopefully have some more education programs. And
sure, Simon.
thank you so much. So,
Yeah, it's been a pleasure talking to you,
okay.
and I'm glad you enjoyed.
Thank you. So we'll say
Thank
goodbye
you.
to the world, and please stay on the line. Thank you.
Bye now.
Bye now.
Yep.